Hello, my name is Melissa and I am a nurse at SSM Health. I will review information that will help you prepare for your discharge from the hospital following your joint replacement surgery. Each member of your care team is here for your support, so please ask questions during your recovery. Recovery from surgery is challenging and it's important you stay focused and motivated. It can take 6 months to a year to fully recover from a joint replacement surgery. The good news is that your recovery instructions are simple. The 5 things to focus on during this time include rest, exercise, ice, elevate, and repeat. It will be your full-time job to follow these instructions for an ideal recovery. Journaling can help you track your progress and gain a better understanding of your improvements and accomplishments. Your therapy exercises build up strength in the joint and surrounding muscles, can ease pain and swelling, and will gradually get you back to your normal activities. Please know that it is normal for your psychological and emotional energy to be affected by medications, pain, sleep deprivation, and a decreased appetite after surgery. Everyone also progresses through recovery differently, so please do not compare yourself to others or compare your experience to a previous surgery, since every surgery and recovery is different. Feeling pain after surgery is normal and part of the healing process, so expect pain, especially during the first few weeks following your surgery. Although we do not expect you to be pain-free, we do want your pain to be tolerable so you are able to move throughout the day with walking and repositioning as well as therapy exercises. Cold therapy is one of the most important tools for pain relief after surgery. Use your ice pack for at least 20 to 30 minutes after therapy exercises, after walking, and use more as needed for swelling and pain. You can use your cold therapy wrap throughout the day and at night. Therapy recommends removing your ice pack 30 to 60 minutes before you plan to do your therapy exercises to allow your muscles to warm up. Please do not use your ice pack when you are up walking because this could cause a tripping hazard. Elevation is another great way to alleviate discomfort and decrease your swelling. Remember that swelling is very normal and often increases after you leave the hospital as you become more active. Many patients notice swelling for 6 to 8 weeks or even longer during recovery. Swelling will improve as you heal, but healing takes time, and swelling may continue on and off within the first year of your recovery. A few tips about elevation include: use pillows to elevate your leg to prevent the fluid from moving down your leg into your foot or ankle. Do not sit in a chair with your feet on the floor for more than 1 hour at a time initially after surgery. Elevate your foot above the level of your heart for at least 30 minutes 3 times a day. After knee surgery, it's very important to keep your knee fully extended or straight when you are resting in bed or in the chair. You can use pillows to elevate the entire leg, but do not put a pillow directly behind your knee, causing it to be bent when elevated. If your knee begins to heal bent, you will have a harder time walking well after surgery. Placing 1 to 2 pillows under your ankle will lift your ankle higher, which forces you to straighten your knee more. After hip surgery, your therapist or surgeon may recommend hip precautions, so please follow these as directed during activity and when you are elevating your leg to help with swelling. In addition to ice and elevation, frequent repositioning when seated or laying down will help with stiffness, prevent complications, and improve your overall comfort. Also think about things to try to help you relax, such as deep breathing, meditation, mindfulness, or aromatherapy. During your recovery, keep yourself busy by doing things you enjoy, such as reading a book, listening to music or a podcast, watching a movie, or playing a game. You will likely also need medications to help with pain after surgery. So first we'll talk about Tylenol. Unless contraindicated, we recommend taking Tylenol or acetaminophen 1,000 milligrams every 6 hours or 650 milligrams every 4 hours for the first few weeks on a regular schedule at home. Please do not take more than 4,000 milligrams of Tylenol over the course of a 24-hour period. By taking Tylenol on a regular schedule, this will allow better pain control, as well as help with your pain control as you begin to wean off of the opioid pain medications, which you may also need right away after surgery. As you begin to take less of the opioid pain medications, continue the Tylenol on a regular schedule. An anti-inflammatory is another good option, but may not be appropriate for all patients. Your surgeon will decide if a prescription anti-inflammatory, such as Celebrex or Meloxicam, is appropriate for you. Please only take the prescribed anti-inflammatory and do not take any over-the-counter anti-inflammatories such as ibuprofen, Aleve, Advil, naproxen. These need to be avoided during your initial recovery period, and you should not restart these over-the-counter anti-inflammatories unless discussed with your surgeon. Opioid medications are commonly prescribed pain relievers. When opioid pain medications are taken as recommended, they can be a powerful tool for comfort after a joint replacement surgery, but only take as prescribed and decrease the use of opioid pain medications as your pain improves. Most insurance plans will cover opioid pain medications after this type of surgery, but they do often have restrictions. For example, your insurance company or your pharmacy may only dispense a certain amount of medication, such as a 7-day supply. For many patients, the hospital prescription will be enough, but if you are in need of a refill, do not wait until you are out of pain medication before you call your surgeon's office. You will need to call your surgeon's office 2 to 3 days prior to needing the medication, and you will also need to call during normal business hours, Monday through Friday. There are some concerns about using opioid pain medications. They do have a potential for misuse and dependency. They can also have many side effects such as severe constipation, nausea, sleepiness, and dizziness. These types of medications also slow and shortens your breathing, which means less oxygen is distributed through your body. We expect that you will need less pain medication each week after surgery. We recommend that you wean off of your pain medication gradually as your pain improves. It's best to first decrease your dose and then begin to increase the time between medication. If you are taking 2 tablets every 4 hours as needed, decrease to 1 tablet every 4 hours as needed. Then take pain medication less often, such as take it 3 times a day rather than 4 times a day. Please do not stop your opioid pain medication abruptly. It's best to gradually decrease use before stopping it completely. And if you have leftover pain medication, please ask your pharmacy or local police station about medication take-back days. Constipation is a big concern going into surgery due to the use of opioid pain medication, lack of activity, and a decreased appetite after surgery. Some suggestions to help relieve constipation include increasing time and privacy for toileting, going to the restroom when you feel the urge, drinking plenty of fluids every day unless your fluids are restricted, avoid bulk laxatives such as Metamucil or Psyllium after surgery. Your daily goal for fiber is 25 to 30 grams while using opioid pain medication. Some examples of high fiber foods include black beans, all bran cereal, peas, oatmeal, bananas, and whole wheat bread. Medications to help with constipation after surgery include stool softeners and laxatives. These medications can be purchased over the counter. Due to the high risk of constipation with opioid use, we recommend taking a stool softener such as docusate sodium, also known as Colace, twice a day to keep your stools from hardening. You may also need to take a gentle laxative, such as Miralax, each day to help prep your gut for a bowel movement. If diarrhea develops, please decrease the use of these medications. A stimulant laxative would be indicated if you do not have a bowel movement for 2 to 3 days after surgery. Stimulant laxatives include Visicodyl or Senna. If the above interventions do not work, then use an over-the-counter rectal intervention such as a glycerin suppository or an enema. There are 2 ways to prevent blood clots after surgery: moving and medication. The goal is to move every hour while you're awake and walk 3 to 5 times a day, in addition to your recommended therapy home exercise program. While sitting, do ankle pumps, quad sets, and glute sets every hour while awake, and also avoid plane or long car travel as directed by your surgeon. All patients will be on a blood-thinning medication after surgery as ordered by your surgeon. For many patients, it will be aspirin, but some patients will need a prescription blood-thinning medication. It's essential that you take your blood-thinning medication as instructed after surgery to prevent blood clots. To prevent infection after surgery, it is very important to keep your incision area clean and dry. Please do not remove your dressing or bandage unless instructed. Wash your hands frequently to avoid the spread of infection. Limit alcohol and smoking as this prevents healing. Make sure you're eating healthy and staying hydrated. It's also recommended that you brush your teeth 2 to 4 times a day to decrease potential bacteria in your system. And please follow your surgeon's dental protocol after a total joint replacement surgery. This includes avoiding dental work for 3 months to decrease your risk of infection. You may also need to take antibiotics after your surgery for invasive dental work, so please discuss this with your surgeon at your follow-up appointment and follow their recommendations. You should not have any procedures within 3 months of your surgery without your surgeon's approval. Most patients go home with a waterproof surgical dressing over their incision. If you will be going home with a different type of a dressing, your nurse will review dressing care with you prior to discharge. Leave this waterproof surgical dressing in place until your 2-week follow-up appointment. Because this dressing is waterproof, you will be able to shower as long as the dressing remains sealed and tight to your skin. However, the dressing should not be immersed underwater, so do not take a bath or go swimming. If you have an ACE bandage over the surgical dressing when you go home, remove that ACE bandage 1 to 2 days after surgery and keep that waterproof bandage in place. The waterproof surgical dressing is absorbent and antimicrobial and is intended to kill bacteria and prevent infection. It's common to see dark spots of drainage on the silver gauze pad, and you may notice an increase in drainage after you leave the hospital. Please call your surgeon's office if you notice your surgical dressing is leaking, filling with drainage as you see here in the picture, or if you are seeing defined areas of redness around your dressing. It's important to know what to expect during your recovery. It is very normal for the first several weeks to have significant swelling, pain, stiffness, and bruising in your surgical leg. You will also likely notice warmth near your incision, and you may even experience a low-grade temperature. Many people experience a decreased appetite after surgery, but having a good diet and drinking plenty of water is essential. Attempt to drink 8 to 10 glasses of water each day and provide your body nutrients by eating fresh fruits and vegetables, as well as foods high in protein and fiber. Most patients find that they are easily fatigued and have trouble sleeping well the first few weeks after surgery. It's often hard for patients to find a comfortable sleeping position. You may also wake up during the night due to stiffness and the need to move or change positions. Be careful getting up at night and be sure areas are clear and well lit. Having a routine to help you wind down at the end of the day, in addition to taking pain medication before bed, is also recommended. It will be important to rest throughout the day, but try to avoid long daytime naps so you are not sleeping too much during the day, making it more challenging to sleep well at night. Many patients find that pain, limited mobility, and a change in their independence can be very frustrating, but remember, this is temporary. Fall prevention at home is very important after surgery. Please take precautions to prevent a fall and have someone stay with you the first few days at home. Use your walker to move around and do not move without your walker, even for short distances right away after surgery. You will be more active as you heal and the pain improves, but please continue to use your walker or assistive device for as long as you need it. Everyone progresses differently through recovery. Make it a goal to move around every 1 to 2 hours, walk 3 to 5 times a day, and gradually increase your activity each day. In addition to walking, follow your home exercise program twice a day. And finally, a quick but important reminder about driving after surgery. Do not drive until your 2-week follow-up visit, and do not drive while you are taking opioid pain medication. Plan to discuss your readiness to drive with your surgeon's team during your recovery, but keep in mind if you had surgery on your right leg, you may not be cleared to drive for 4 to 6 weeks. Remember, this new way of life following your joint replacement surgery is only temporary, and the benefits and the long-term outcome will far exceed what you are experiencing and going through right away after surgery. It may be a little frustrating at first, but keep your head up and remember that your health is worth it. Before you leave the hospital, your care team will review your discharge instructions, including your medications and your follow-up appointments. You will have a 2-week and a 6-week follow-up appointment with your surgeon's office. If you have any questions during your recovery, please call your surgeon's office. Any questions outside of normal clinic hours, please call the Dean On-Call nurse line at 1-800-57-NURSE. A successful outcome takes patience, hard work, and dedication. Each accomplishment, even if small, is an important step in the right direction of your recovery. Do your best to see your goals, understand the obstacle, create a positive mental picture, clear your mind from doubt, embrace the challenge, Stay on track and show yourself that you can do it. Thank you for listening today, and we wish you well during your recovery.